Shall I go ahead, ma'am?
Yes, ma'am.
A very good evening to Dr. Sanjay Bedi, sir, all resource faculties, and dear participants. Before moving on to the presentation session today, I thought it would be apt to do a quick recap of early clinical exposure as it is given in the MCI module. The objectives of early clinical exposure is to recognize the relevance of basic sciences with regard to diagnosis, patient care, and treatment, to provide a context to enhance basic science learning, to use patient experience as a motivation to learn, to recognize attitude, ethics, and professionalism as an integral part of doctor-patient relationship. So we teachers are no longer called as teachers. We are called as facilitators. So what is the role of a facilitator? We just need to walk along by the side of a student in the stage of a novice up to the stage of an expert. So from the stage when he says, I won't do it, I can't do it, up to a stage when he claims to have accomplished, yes, I did it. So that is the role of a facilitator, to carry forward along with you the student from the novice stage up to the expert stage. Exactly what parents do at home and what in ancient ages our Guru Sishya Parampara also enunciated. That is the role of a facilitator. We need to provide the right kind of motivation, appropriate environment, and positivity for the student for a successful learning process. The elements of early clinical exposure are basic sciences correlation, to apply preclinical knowledge to locate, diagnose, and understand treatment modalities, and even sometimes to identify complications and to manage complications. Not the depth of the treatment, what I mean here, at least they should know why complications are occurring and how are you going to handle the complications. The basic science correlation exactly in the clinical subjects. Clinical skills, I'm not talking about procedural skills here. It is about attitudinal and communication skills like talking to patients, ethics and professionalism, critical and analytical thinking, which can be enhanced. Humanities for a broader understanding of socioeconomic and cultural context within which healthcare delivery operates in our country. The structure of the program for students should be drawn out in a very well-structured and systematic way. Meticulous planning should be done. So you need to draw out a stepwise plan for every ECE session, decide the topics and when to implement the ECE sessions during the course of the routine teaching so that the topics blend well with the region that's being taught then. Choose topics wisely to match feasibility of your institution. Discuss the logistics or resources, whatever you need. It may be stationery, it may be internet connection, it may be faculty, your basic science faculty or your clinical faculty. You need lecture halls and you need patients, ward, whatever you need, any kind of logistics required should be discussed with the administrators and colleagues. Fix a faculty as ECE coordinator from your own department. Involve clinical faculty in all these discussions. Document all discussions as minutes so that everyone takes up their responsibilities and roles in the right way. The total hours allotted for anatomy is 30 hours. Every basic science discipline has got 30 hours to be implemented in the form of ECE. Classroom setting, 18 hours, 6 sessions of 3 hours each. Hospital setting, 12 hours, 4 sessions of 3 hours each. So these 18 hours of classroom setting, 6 sessions can be done in the first 6 months. If possible, we can wind it up in the first 6 months with simple topics as classroom settings. And the hospital settings, the 4 sessions can be done along with the classroom setting every month once or once in 2 months also. Preferably, we can wind up everything at least 2 or 3 months before their summative assessment or university examinations. Depending, and this is not very rigid, it's flexible. Depending upon the feasibility in your institution, you can fix up the classroom setting sessions and the hospital setting sessions as well. How to effectively use 3 hours of ECE. So every ECE session will extend for 3 hours. You need to draw out an action plan, how you're going to split it. And the splitting is given in the ECE module by MCI. And this splitting up of the duration, how are you going to effectively utilize it for implementing ECE? So first 30 minutes, the module should be introduced to the student. Instruction should be given by the anatomy faculty. What is going to happen in the next 3 hours? Next 90 minutes is the main duration or the most important duration during which the learning is going to happen. In a classroom setting, a paper case or a video will be discussed by anatomy or clinical faculty with a guided observation and checklist. What do you mean by this guided observation and checklist? The student is provided with a list of what he is supposed to observe and what he is supposed to learn from that particular session of ECE. So he has to tick everything. You can give it to the form of a soft copy to him, circulate in a Telegram or WhatsApp group, or you can even circulate in the form of a Google form, or you can give it as a hard copy paper sheet where he can tick and find out that he has checked and understood all that has been taught in that particular ECE session. If it's a hospital setting, clinical experience in OPD ward will be discussed by a clinician with again a guided observation and checklist provided to the student. Observers, that is students, must have a checklist to observe the various criteria which will enable him to enrich his learning experience. The next 30 minutes, the last but 130 minutes, will be the summary and conclusions by the faculty with the vital learning points being emphasized there, which is known as facilitator's guide. The last 30 minutes will be feedback and reflection from students. Feedback is definitely mandatory, which helps us to improvise ourselves for the next forthcoming sessions or forthcoming batch. And reflection from the students. Reflection is the perception and the acceptance from the students. After all, he is a stakeholder of the entire program. So we need to know what's going on in his mind about this program, how well he has received it, accepted it, and how well he has perceived it. So these documentations have to be maintained in the department. Feedback can be obtained in the form of a Google form questionnaire. Reflection, we in our institution, we ask them to write it in an A4 paper and submit to us. And for every ECE session that we conducted, we have maintained it in the file. So all these will go into the filing of the department. Of course, assessment drives learning. Without assessment, the student is not going to learn anything at all. So assessment becomes mandatory for every ECE session. You do not have a test after every ECE session. You can have even a pre-test and a post-test questionnaire, which can tell you about the effectiveness of your session, whether he's able to pick up some points from that ECE session. Even during the course of the session, the attitude, the behavior of the student in the classroom, in the hospital, everything can be monitored and assessed. You assign a faculty around 25-30 students for one faculty, give him a sheet of paper with the register numbers or names written, and ask him to observe the students and keep marking them or keep scoring them. So this can be done in the classroom setting as well as in the hospital setting. So students' activities during ECE sessions like patient interactions, simulated patients, attitude during session should be monitored and assessed. Elements from ECE can be assessed in formative and summative assessments. You can use these ECE topics to word your questions, your LAQ, SAQ, BAQ, and your brief answer questions and MCQs. All these different forms of assessment tools can utilize your ECE topics in internal assessment as well as in university examination also, and also in practical examination in the form of OSPE. So this will best help to test his ability to apply basic science knowledge in clinical correlation. So assessment becomes mandatory. Now, this entire program, ECE session, the planning, strategy, implementation, everything gives scope or room for capacity building for the faculty. So faculty must be well oriented with the plan and implementation of ECE. There should be good coordination between phase 1 and clinical departments. Faculty must be adequately sensitized and trained to develop and implement ECE modules, and also in the setting of question papers which include ECE topics in them in the form of various types of assessment tools. So faculty need to be trained adequately and sensitized adequately as well in the implementation of ECE program, because we should not cut a sorry figure in front of the student in a classroom setting or in a hospital setting. The faculty whosoever is going for that particular session should know very well what's going to happen in the next 3 hours of that particular ECE session. Implementation, monitoring, and curricular governance. So ECE is not implemented just by one department alone. Right from the curriculum committee up to the MEU, everyone is involved in the planning and strategy formation and implementation and looking into feedback and reflection of the entire ECE program. So what is the role of each of these bodies or teams and designations? The curriculum committee is involved in planning, implementation, and oversight of ECE in collaboration with curriculum subcommittee and heads of departments. It will also review and document ECE sessions and make changes if need be. It will help in the logistics required. If you need anything in the hospital or classroom, which is not available, you can ask them to arrange for it. It also ensures CBME curriculum is implemented by all departments effectively. So the curriculum subcommittee will work in coordination with the curriculum committee. The dean will convene meetings with curriculum committee and heads of departments to monitor a proper implementation or effective implementation and progress of ECE sessions by phase 1 departments. The heads of the departments will function as coordinators of ECE sessions in their own disciplines, and every department should have a faculty ECE coordinator who will be the point of contact for all the ECE sessions for that particular year or batch. The MEU on the whole will train and orient all MEU resource faculties. It will also conduct sensitization programs for all faculties, including dean, right from the top, including dean, heads of the departments and faculties of all levels in all departments. So this is how the implementation monitoring and curricular governance helps in successful implementation of ECE programs. There are wonderful articles available in the internet. You can go through so many articles. These two, I found them very interesting. How effective early clinical exposure is in the Western world. Definitely, we have introduced it only now for this 2019 batch, the exam going batch in India by MCI. So I think in the years to come, we will find that early clinical exposure is going to be very effective, and it's going to really, give very good success in the career process of the medical students as well. And if you ask the students about the reflection, they said that this entire ECE has shaped them up so well in the first year that what their dreams or aspirations were when they were preparing for the NEET exam, all that is coming true. They were feeling that when they went to the hospital and sitting in the classroom setting, they felt that whatever their dreams were is almost slowly coming true one by one when they experience this kind of ECE sessions dealing with different clinical topics, though they did not know about the diagnosis or disease process or their treatment modalities. Still, it was getting them close to the entire medical program. So this is what was their reflection. They were feeling so happy that they are into the right stream in their life. So I wish to end by stating that if your plan, strategy, and implementation of ECE is proper and complete in the right direction, then success of the program is assured. So with that, I close my short glimpse or quick recap on ECE. Thank you very much for your patient listening. We now move on to the presentation sessions. Ma'am, I'll continue with the presentation, ma'am.
Yes, ma'am.
Is my screen visible, ma'am?
Yes, ma'am.
So moving on to the second session of ECE presentations, we are having groups D, G, H, I, J, and K presenting today. So the first group to go on for presentation is group D1, guided by Dr. Angela ma'am. The presenter is Dr. Bhavana. The topic is catheterization in a laboratory setting. So can we proceed, Dr. Bhavana? You want me to share the screen or you want to share it yourself?
Hello, ma'am. I will share my screen. Is that okay?
Okay. Yeah, sure, definitely.
Thank you, ma'am.
You may share your screen now.
Yes, ma'am. Is my screen visible, ma'am?
Yes, it's visible.
Okay.
Please go ahead.
Yeah, thank you, ma'am. Good evening, everyone. Myself, Dr. Bhavna. I'm from Group D, and we are today presenting the ECE module on catheterization. At the outset, I want to thank our resource faculty, Dr. Angela ma'am, for her very good inputs and encouragement. And I want to thank the rest of the group members of Group D. So I will start with my presentation. Our module is catheterization, and its in setting is the skilled laboratory. So the ECE module is for the first year MBBS or phase 1 students. The setting is skilled laboratory. The topic of basic science which we need to cover here is anatomy of urethra. The ECE will be done through demonstration of the procedure of catheterization in skilled laboratory on mannequin with or without a video showing the catheterization. The goal of the entire module is the phase 1 student must be able to understand the anatomy of urethra and its importance during catheterization. We went through the MCI volumes and we found that there is one relevant existing competency in volume 3 involving the orthopedics and anesthesia integration. It is orthopedic competency 13.2. Here they say that participate as a member in a team for resuscitation of polytrauma victim by doing all of the following: IV access central, peripheral, bladder catheterization. This is for catheterization. Then endotracheal intubation and splintage. In volume 1, there is not a relevant competency, but we found two which are related to our competency. So AN 46.3, which describes penis under the following headings: parts, components, blood supply and lymphatic drainage. This will be helpful in male catheterization. And AN 48.2, describe and demonstrate the position, features, important peritoneal, other relations, blood supply, nerve supply, lymphatic drainage, and clinical aspects of important male and female pelvic viscera. So here the pelvic part of the urethra can be covered. So these are the two relevant. Now the total time for the module is 3 hours. The expected competency after the module is describe features of male and female urethra, demonstrate understanding of procedure of catheterization in male and female with its anatomical correlation, demonstrate understanding of effective communication with the patient during the procedure of catheterization, demonstrate understanding of importance of biomedical waste disposal. The objectives are, at the end of this ECE module, phase 1 student will be able to describe features of male and female urethra, enumerate at least 2 indications for catheterization, explain about the informed consent, explain importance of aseptic precautions during procedure, enumerate steps of the procedure of catheterization, explain anatomical basis of and care to be taken to avoid male urethral damage during the procedure, explain importance of waste disposal at the end of the procedure, explain importance of doctor-patient communication throughout the session. So what are the teaching learning methods that will be used? So for the entire process, the students will be, of course, divided into batches of 25 or 30. And then the TL methods will be small group discussion with a short video to review the basic anatomy as well as to see the procedure. Actual demonstration of mannequin will be followed in the skilled lab. Then we can also use a human, either volunteer or a simulated patient, to demonstrate the part of doctor-patient communication. I have given here, we have given here the YouTube link available, but we prefer as a group that the institute should make their own videos, which will be helpful. The learning experience of entire 3 hours can be divided as follows: introduction and instruction to the students, 20 minutes, exposure to the procedure on mannequin, 45 minutes, discussion with the students about their observations, 45 minutes, feedback will be for 30 minutes, assessment will be for 30 minutes, summary and conclusion for 10 minutes. The facilitator guide will be provided. So what are the features of male and female urethra? What facilitator should discuss in the session is what are the features of male and female urethra? What are the common indications for catheterization? How to take informed consent for catheterization? How and what will you communicate with the patient throughout the session? What aseptic precautions should be taken during procedure? What are steps of the procedure of catheterization? What precaution you will take to avoid male urethral damage during procedure? And how will you dispose biomedical waste generated during the procedure? So what are the resources needed? So for every batch of 25 or 30, we will need a skilled lab, male and female catheterization mannequins, short procedural video, all the equipment which is needed for the procedure, one demonstrator, and an appropriate biomedical disposal bags. Now the feedback will be in 2 forms. One is reflections on the experience. This is from the students, both feedbacks. Reflections, they will write for around 30 minutes. So there are 3 questions which we have picked up from the MCI module itself. So what did you learn from this experience? So here we can also divide it into about doctor-patient communication, procedure of catheterization, and importance of waste disposal. Then the second question is, what are the applications of this learning? That means in future, how will you be applying what you learned today to same or similar scenarios? And what knowledge or skills do you need to develop so that you can handle this type of situation in future? Then on the module itself, we can take a feedback about the conduction and their experience. So did this, again, these questions are from the MCI document, but we have modified a little bit. Did this ACE module help in making it easy to understand the relevant anatomy? Did the ECE module make learning basic science subject more interesting? Are you motivated to read further on this topic as a result of participating in ECE? Was this module useful in learning attitudinal or communication skills? If yes, what have you learned today? Suggest changes in the program that will help you learn still better. Then assessment will be, again, assignment will be given for 30 minutes. We can have various forms of assignment. These are just 2 as an example. So describe features of male and female urethra. Maybe we can also ask comparison from them, and describe importance of effective doctor-patient communication during catheterization. So that's all. Thank you, everyone.
Thank you, Dr. Bhavna, for that vivid presentation.
Can I stop share, ma'am?
Yeah, yes, you can stop sharing.
Thank you, ma'am.
The next presenter is from D2, Dr. Rekha Maruti. The topic is episiotomy in hospital setting. Dr. Rekha, do you wish to share your own screen? Dr. Rekha,
yes,
you wish to share your screen?
Yes, ma'am. Yes, ma'am. I would like to share my screen.
Okay, okay. Please go ahead.
Is my screen visible, ma'am?
Yes, it's visible.
Okay. Good evening, everyone. On behalf of Group D, I am Dr. Rekha, presenting to you ECE module. We designed this module under guidance of our resource faculty, Dr. Angela ma'am. So topic is episiotomy. Audience is first year MBBS student and setting is hospital. Topic of basic sciences is perineum. ECE is through demonstration of episiotomy procedure in labor room on patient. What is the goal? The student must be able to recognize clinical relevance of perineum and also understand role of basic sciences in patient care and management. As per our last discussion, relevant competency in MCI document, volume 1, topic is perineum. Competency number is AN 49.5. Explain the anatomical basis of perineal tear, episiotomy, perianal abscess, anal fissure. Volume 3, topic is operative obstetrics. Competencies are 2, 15.1 and 15.2. Both belong to domain skill. Enumerate and describe the indications and steps of common obstetric procedure, techniques and complication. Episiotomy, vacuum extraction, low forceps, C-section, assisted breech delivery, external cephalic version, cervical cerclage. 15.2, observe and assist in performance of an episiotomy and demonstrate the correct suturing technique of an episiotomy in a simulated environment. Observe or assist in operative obstetric cases, including C-section, forceps, vacuum, and breech delivery. Both these competencies are core competency. Based on that, for ECE module, expected competency for first year student, first, describe features of perineal body and perineal membrane in female. Demonstrate understanding of basic sciences knowledge in an episiotomy procedure. Competency from ATCOM module, demonstrate ability to communicate to patients in patient, respectful, non-threatening, non-judgmental, and empathetic manner. Objectives are, at the end of the ECE module, phase 1 student shall be able to First, explain structure of perineal body, explain boundaries and content of superficial perineal pouch, explain attachments, fascia covering, and nerve supply of transversus perineal muscle. These are purely from the anatomical part. Next, from the clinical part, list indications of episiotomy, list types of episiotomy with its anatomical correlation, list layers cut in episiotomy incision, explain the basis of the incision, interpret steps involved in episiotomy procedure. Next, mention immediate and late complication of episiotomy. Objectives from the ATCOM modules and others is explain informed consent, understand importance and technique of effective doctor-patient communication. After objectives, the teaching learning method which we opted are, students can be divided into groups of 25 to 30. These small group students are provided with a PPT with the procedure video, preferably from the same setting. This is done to recall the basic anatomy and to note the steps of the procedure. This is followed by observation of a patient in a labor room. While observing, they are provided with the observation guide. This is also accompanied by the demonstration of technique of informed consent and effective doctor-patient communication on a student volunteer or a simulated patient. How this whole learning experience will go: introduction to module and instruction by a preclinical faculty about the observation guide for 20 minutes, exposure to procedure 45 minutes, discussion with the students about their observation checklist is 45 minutes, summary and conclusion for 10 minutes. This is accompanied with the reflection, assessment and assignment. So what is the observation guide? Students are provided with the observation guide. Checklist is this: observe position of patient for procedure, observe safety measures taken into consideration while taking the incision, observe step of anesthetic agent administration before taking a surgical incision, observe suturing of the incision, observe aseptic precaution taken throughout the procedure, observe different aspects of doctor-patient communication, observe norms followed for the biomedical waste disposal. This observation guide will help us in the discussion part of our learning experience, where we will focus primarily on the lithotomy position, perineum, layers, content, nerve supply and all. So they can understand it better. What is the resources needed? Students in a small group, PPT with a procedure video, equipped labor room, female in a labor, surgical toolkit for procedure, one preclinical faculty and one clinical faculty. Next is reflection. Reflection is for 30 minutes. Same from this is taken from the MCI document. What did you learn from this experience? Structure of perineum, surgical relevance, steps of procedure and precautions taken, doctor-patient communication. What is the application of this learning? Third, what knowledge or a skill do you need to develop so that you can handle this type of situation? Next is feedback. Feedback from the student and feedback from the faculty. Feedback from the student to evaluate improvement in module. How helpful was the ECE modules been in improving your knowledge about the clinical aspect of perineum? Which component of program helped you to learn? Did ECE module make learning of basic sciences subject more interesting? Are you motivated to read further on this topic as a result of a participant in a ECE? Suggest positive changes in a program that will help you to learn still better. From faculty point feedback, written feedback can be taken whether outcomes were achieved and suggestions to improve the program. Finally, the assessment. Assessment can be done it's very subjective, can be done on an assignment base, lasts for 30 minutes. Example, we can give a short answer question. Sample questions could be: describe perineal body, describe boundaries and content of superficial perineal pouch, and explain perineal tear. With this, I end my presentation. Thank you, team, and thank you, faculty. Be safe. Take care.
Thank you, Dr. Rekha, for that wonderful presentation.
1 second, stop sharing.
The next presenter is from G1 group, Dr. Suma, guided by Dr. Nidipuri ma'am. The topic is Down syndrome in a hospital setting. Dr. Suma, do you wish to share your screen?
Yes, ma'am. I wish to share my screen.
Okay, please go ahead.
Okay, ma'am. Thank you. Ma'am, is the screen visible?
It's visible. Yes.
Okay, ma'am. So the ECE topic for the G1 which has been assigned is in relation to the ECE module for first year MBBS students in hospital setting for Down syndrome. So I wish to acknowledge the contribution by the organizing team for giving me an opportunity to share my experience in relation to the ECE which I am going to present now. I wish to thank the group facilitator, Dr. Nidhi ma'am, for helping me in preparing this document. So the competency is ECE, the early clinical exposure for first year MBBS students in relation to Down syndrome in a hospital setting. This has been mentioned in the MCI document under the competency number 75.1 in relation to describe the structural and numerical chromosomal aberrations. So the objectives for this ECA module will be the students of the phase 1 MBBS should be able to enumerate the phenotypic features of Down syndrome. They should be able to interpret the karyotype of Down syndrome. They should be able to enumerate the etiological factors responsible for it, to state the significance of genetic counseling in such cases. They should be able to discuss the variation in risk of Downs based on maternal age, to describe the significance of prenatal diagnosis in Down syndrome. So to achieve these objectives, what are the teaching learning methods which will be required? So in case of a hospital setting, a case-based small group teaching can be done in the hospital wherein we are making a group of 30 students each, and each group will be handled by a coordinator, and they will coordinate with the clinical department, so that it will be split into 2 weeks, and each group will be taken to the hospital on a rotation basis. As well as when the students are in the hospital, even case scenarios can be utilized if cases are not available. And in some hospitals, if a real patient setting is not feasible, we can also adopt a simulated patient or an investigation report, paper-based case, as well as the models to help in making the students learn about the Down syndrome. So as discussed by Dr. Gunapriya ma'am, when the students are taken for this session, we need to formulate an observation guide, so that the student will know exactly what they are expected to observe during the session. So in the initial 30 minutes, the facilitator guide will brief about the what they are expected to do in the hospital, followed by explanation by the clinician in the hospital with the help of patients. And after that, there will be a conclusion and a summary by the facilitators. So what are the resources needed? Usually this will be coordinated with the pediatric department. So patients in the hospital for which we need to take a consent, so that they are comfortable to be observed by the students. This is very significant, because already coming to the hospital and getting exposed to so many students, there will be a little bit fear in the patient. So it is essential that we take a consent. So this part instills the importance of taking consent whenever the students in their future, they want to examine a patient. Then we also can take help of charts and videos. So following the ECE exposure, the next 30 minutes will be for the feedback. So the following is a list of questions we have formulated for this. How this ECE on Down syndrome has been helpful to you in improving knowledge regarding the importance of genetics in the pediatrics as well as in the other clinical departments. Which components of the program helped you? Did the session make learning basic sciences more interesting? Do you like to read more on the topic? And any suggestions to improve the program? So for this ECE, the assessment can be done in form of a short answer question, OSPE, or in form of a Viva OSCE. So that's it from my side. I wish to thank you, my team, as well as all the other members of the organizing team and the participants. Thank you.
Thank you, Dr. Suma, for the wonderful presentation.
Thank you, ma'am. I will stop
Now,
sharing, ma'am.
yeah, you can stop sharing.
Thank you, ma'am.
We now move on to the next presenter, Dr. Swati Yadav from G2. The topic is Turner syndrome in a classroom setting. Dr. Swati, do you wish to share your own screen?
Yes, ma'am. Good
Please go
evening,
ahead.
ma'am. Okay,
Good
ma'am.
evening. Please go ahead.
Good evening, everyone. Am I audible?
Yes, you're audible.
Okay. So, good evening. I'm representative for group G2 and my facilitator is Dr. Nidhi Puri ma'am. I'm Dr. Swati Yadav and ECE module for today's presentation is on Turner syndrome. So, in the classroom setting, so beginning with the case scenario, a 16-year-old female visited the obstetrician and gynecologist with the complaints of delay in onset of menstruation and swelling of hands and feet. On examination, she had poorly developed breast and broad chest, webbed neck, low set ears with prominent earlobes and drooping eyelids. So the expected competency relevant to my topic in MCI document is AN 75.1, which is describe the structural and numerical chromosomal aberrations. So with this, we describe the types, cause, clinical features, and diagnosis of Turner syndrome. So with this competency, we can pull out the objectives via this. At the end of this session, phase 1 MBBS student shall be able to define Turner syndrome or 45X syndrome or gonadal dysgenesis or what is Ehrlich-Turner syndrome. Enumerate the clinical features of Turner syndrome at birth and during infancy precisely. Describe the clinical features of Turner syndrome correctly. Identify the syndrome in a given karyotype correctly. Discuss the types of Turner syndrome. Describe the risk factors associated with Turner syndromes. Discuss the commonly used diagnostic test. And lastly, discuss briefly about treatment plan in patients of Turner syndrome. So for this, we can use teaching learning method. Large group interactive lectures can be taken, video demonstration for a small group, and as I already discussed the case-based learning for a small group discussion. And this case-based can also be used for large group lectures. Resource we needed as this is classroom setting, so PowerPoint presentation is needed. We can show video clips. Patient can be bring to class if it is available and if we coordinate with the obst and gynae and pediatrics patient, pediatric departments. And for a small group discussion, we can have museums which has models on this Turner syndrome patients and charts available for this. And also we can provide, we need pre-test and post-test questionnaires. For feedback, we can give questionnaire of a 5-point Likert scale via Google form to know the effectiveness, understanding, and more sessions like this should be held or not. MCQ is also one of the way to know or to assess the understanding of the session. And lastly, the assessment of the students can be done via short answer questions, MCQs, Viva Voice, spotters, and OSP stations. So this is all from my side. I would like to thank my resource person and my group members to helping me for this. Thank you.
Thank you, Dr. Swati, for the clear presentation. You may stop
Thank you, ma'am.
sharing your screen
Okay,
now.
ma'am. Okay, ma'am.
Next presenter is Dr. Kanansha ma'am from H1, guided by Dr. Anjali Subnis. The topic is Fallows tetralogy in a classroom setting. Ma'am, would you wish to share your screen, ma'am?
Yeah.
Please go ahead, ma'am.
Yes, sure. Can you able to see my screen,
Yes, ma'am.
ma'am? Yeah. Thank you so much. Good evening, everyone. I'm going to present a ECE module for the first year MBBS student in the classroom setting, and that is about the Fallot's tetralogy. Myself is Dr. Kanan Shah, and our facilitator is Dr. Anjali Sabnis. We are very much thankful to her for this for the preparation of this module. In Fallot's tetralogy, the competency is from volume 1, that is AN 25.2. They describe development of heart. And this is, it belongs to the knowledge domain. Competency level is a knows how level, and it's a core competency. Second competency is AN 25.4. Describe embryological basis of the Fallot's tetralogy, and it also belongs to the knowledge domain, and level of competency is knows how and its core competency. So that is given in the volume 1. The another competencies are the volume 2, that is in the volume 2, that is PE 23.2, that is pediatric 23.2, discuss the hemodynamic changes, clinical presentations, complications, and management of FT, Fallot's tetralogy. Objective for this competencies for the first phase learners at the end of ECE session, the phase 1 MBBS student should be able to describe development of heart with label diagram correctly, development of ventricular septum with label diagram correctly, development of pharyngeal arteries with a label diagram correctly, identify structures in the model, embryological model of the development of the heart correctly, describe embryological basis of Fallot's tetralogy, the 4 components of the Fallot's tetralogy, that is pulmonary stenosis, ventricular septal defect, overriding of the aorta, and right ventricular hypertrophy. Correlate anatomical basis of the clinical features. So these are the objectives of the module. For this, the teaching learning methods are small group discussions along with the models, self-directed learning, in that we are keeping the seminar, and video. Resources which are required, that's the faculties, LCD projector, if the available, the patient or the case or the photographs of the patient of the Fallot's tetralogy, video, and the models, embryological models. Facilitator's guide, there is embryological aspect of the development of the heart. In facilitator's guide, what are the components of the Fellett's tetralogy? What is cyanosis? Cause of cyanosis in the Fellett's tetralogy, and cause of dyspnea in the Fellett's tetralogy. Feedback from the student. We can ask many questions, but here we have given the few examples like question 1 to 3. In that, the learner has to give the full of the ECE module. Learning was interesting. Concept made is simple. So they have to give these 3 answers onto the Likert scale of 1 to 5. 4 and 5, they are the most out of that ECE module. And the learning experience here, first we'll take of 30 minutes introduction and the instruction part of the Fellett's tetralogy. Then in next 60 minutes, the case explanation. The case already I have given a girl aged 4 months presented to the clinic with the cyanosis, shortness of breath, and the parents saying that since birth, the child has episodes of prolonged crying. On examination, clubbing of the fingers are there, less weight and heart murmurs are there. What is likely diagnosis and describe anatomical basis of the clinical symptoms. So this case, we have to discuss into the small group, and also we just discuss as a learner to find out the clinical manifestations correlation with the this case-based discussion. So that is in the small group discussion of 30 minutes. Then in the summary and the conclusion, that will take 15 minutes, and that is done by the facilitator. And in next 30 minutes, we ask the learner to write down the reflection of this whole learning process. And finally, the assessment in 15 minutes. For the assessment, we can ask the questions like describe development of the heart, that is of the nose-how level. We can ask the nose level questions like enlist 4 components of the Fellett's tetralogy. We can ask the MCQ of nose and nose-how level. We can frame it, as well as the OSPI or the Viva-Voce we can take up to the nose-how level. So thank you so much. And again, I'm very much thankful to Dr. Anjali Madam. She supported us very well in the framing of this module. Thank you so much.
Thank you, madam. Thank you for that clear presentation. Moving on to the next presenter, Dr.
Thank you, madam.
Shadapti
Can I stop
Sarkar.
sharing?
Yes, ma'am. Please, ma'am. Thank you, ma'am. Moving on to the next presentation from I1 group by Dr. Shadapti Sarkar, guided by Dr. Praveen Iyer, sir. The topic is Parkinson's disease in a hospital setting. Dr. Shadapti, do you wish to share your own screen?
Yes, ma'am. I want to share my screen.
Please go ahead.
Ma'am, is it visible, ma'am?
Yes, it's visible.
Good evening, all. Today our EC module is on Parkinson's disease, and it is to be done in the hospital setting. So we are conducting it for first year MBBS students. We are batch 2019 and 20, and we are conducting this EC module in the March 2020. Because at that time, we are taking the classes on neuroanatomy. And here the setting can be the medicine or neuromedicine OPT, which is available in that institution. The goal of this EC module is that the student should be able to know the clinical features, that means the signs and symptoms of Parkinson's disease and its anatomical correlation. The expected competency is that to discuss the clinical features of Parkinson's disease and its anatomical correlation. The learning objectives, sorry, ma'am. The learning objectives are the state the structures of the brain involved in Parkinson's disease, enumerate the symptoms of Parkinson's disease, enumerate the signs, explain the anatomical correlation of clinical features of Parkinson's disease, observe the steps of examination of the patient, identify the area of the brain in CT scan involved in this disease, demonstrate the counseling of patient and patient party regarding the diagnosis, treatment, and prognosis of disease. Discuss the importance of follow-up visit. We divide this learning experience in introduction and instructions for 60 minutes, exposure to the hospital 30 minutes uh, for each batch, because we have taken the 100 students batch and we are dividing the batch into the 8. I'm coming to the later, the program follow-up. And the summary and conclusion will take 30 minutes, reflection 30 minutes, and assessment 30 minutes. The teaching learning method will be the interactive lecture in lecture theater and small group discussion in demo room adjacent to the medicine OPD or neuromedicine OPD. The resources are the patient, the clinicians from the medicine department or from the neuromedicine department, concerned anatomy teacher, audiovisual aids, and demonstration room adjacent to the OPD with the facility of examination equipment and view box. This is the case, that is the Mr. Rahim, a patient ages 60 years, attending the medicine OPD with the complaint of tremor, difficulty in standing and walking for last 2 months. He had no history of trauma, headache, nausea, unconsciousness, and substance abuse. On physical examination, muscle rigidity, involuntary movements, reduced facial expression, and problems with coordination had been found. CT scan of the brain has been done. The scan had no significant changes. The facilitator's guide will be the explain the cause of involuntary movements, explain the structure of the brain involved in Parkinson's disease, and showed the area of involvement in CT scan, explain the clinical features, explain the importance of early diagnosis and regular follow-up of the case. The assessment can be done by written and VIBA and OSPI. In written, the multiple choice question or short answer questions can be done, and here we are main focus is on the assessment is what are the learning points from the this EC, and we'll be able to counsel the patient for the regular follow-up. For the second one, we can set this OSPI session. So the program evaluation can be done that did this program help you to understand the clinical feature of Parkinson's disease? Did it help in remembering the structure involved in Parkinson's disease? Did it help in identifying the structure involved in Parkinson's disease in CT scan? Which component of the program helped you to learn? Did the ECE module make the learning basic science subjects more interesting? Are you motivated to read further on this topic as a result of participating in ECE? And suggest the changes in the program and topics for future ECE modules in the hospital setting. We also take the written feedback from the concerned faculty regarding their opinion as whether the outcomes are achieved and suggestions to improve the program. The reflections are the practical aspects related to the examination and investigation of the patient and patient counseling and the challenges faced during the proper examination and patient counseling. So we did this EC module with the help of this program flowchart. The first, the HOD anatomy planned the EC module after discussion with the concerned anatomy teacher, the dean of the institution, medicine or neuromedicine head of the department, and concerned clinicians. After that, the concerned anatomy teacher, after the meeting, the concerned anatomy teacher selected the date and took an interactive lecture on basal ganglia, substantia nigra, and its applied anatomy and involuntary movements of the body. Then it divided the 100 students into the 8 batches. So 8 batches attended the medicine or neuromedicine OPD in 2 days. First day the 4 batch, second day the 4 batches. The facilitator from the medicine or neuromedicine department explained the clinical features of the case, demonstrated the examination of the patient, explained the relevant points in the CT scan of the patient, and patient's counseling in the adjacent demo room to the OPD. Summarization, assessment, and feedback are taken on anatomy classroom. And for the each batch, we have some the anatomy department can give some observation guide for batch A1 and A2. That means batch A1 if come on Monday, batch A2 come on Tuesday. So they are giving to the topic mainly observation guide on instruction of doctor to the patient and history taking. So these are the points that the formal introduction of the attending clinician and the other team members to the patient regarding the rest of the observation guides on the history. Second, batch B1 and B2 are on the examination of the point, seeking the permission from the patient for examination, the steps of general examination, and the nervous system examination. Whereas batch C1 and C2, they are allotted the checklist for the management of the patient, the investigation advice, the identification of the area of the brain involved in Parkinson's disease in CT scan, and discussion of the available treatment option. Whereas for batch D1 and D2, the counseling of the patient and the patient party, explanation of the nature of the disease to the patient and patient party, and explanation of the importance of the early diagnosis, treatment, and regular follow-up of the case. So we can give these observation guides to all 8 batches, and after that, in second day, the whole batch come back to the lecture theater, and the summarization, the feedback, and the assessment can be taken there. Thank you, ma'am.
Thank you, Dr. Shadapti, for the wonderful presentation. Well-designed
Thank you,
ECE
ma'am.
module with a flow chart also. It was excellent. Thank you very
ma'am.
much.
Thank you, ma'am. Thank you, team. So, ma'am, I stopped share my screen.
Yes, you may do so. We're now moving on with the next presenter from I2 group, Dr. Monica Srivatsava, on the topic hemiplegia in a classroom setting. Dr. Monica, do you wish me to share the screen for you?
I will share the screen.
Okay, please go ahead.
Thank you, ma'am. Thank you, ma'am. Now it is visible.
Yes, it's visible.
Good evening. Okay. Good evening to all. Myself, Dr. Monica Srivastava from Group I2, going to present our ECE module on hemiplegia. Audience are the first year MBBS student, and the settings are the classroom set. Competency, explain the anatomical basis of hemiplegia. Our objectives are, at the end of session, a student should be able to define the hemiplegia, understand the difference between paresis and plegia, enumerate the causes and the risk factor of hemiplegia, enumerate signs and symptoms of hemiplegia, describe the anatomical basis of the symptoms. A student should be able to perform the clinical examination, elicit the motor involvement, and scale the muscle strength. The student should be able to elicit the deep and superficial reflexes, examine for sensory loss, check for the bladder and bowel involvement, describe the type of lesion. It is upper motor neuron type or lower motor neuron type. Locate the site of lesion. Now, in teaching learning method, we can use the interactive lectures, small group teaching on actual patient if possible, or we can teach through the problem-based questions or pre-recorded videos. In resources, we need patient from OPD or IPD, experts from the clinical streams, and instrument for testing, and the audio-visual aids. For feedback, pre-test and post-test based questionnaire by which we can check the knowledge gained by the student about hemiplegia, assessment via problem-based learning, multiple choice questions, viva voice, and the practical evaluation. That's all. Thank you, ma'am.
Thank you very much, Dr. Monica, for the clear presentation.
Thank you, ma'am. I'm stopping sharing the slide, please.
Yes, please do so. We're now moving on to the next presentation from J1 group by Dr. Asha, guided by Dr. Rajeshri Chandar, The topic is cataract in a hospital setting. Dr. Asha, do you wish to share your own screen?
Hello, ma'am. Am I audible, ma'am?
Yeah, you're audible. Do you wish to share
Yeah.
your own screen?
No, please share the screen for me, ma'am.
Yeah, please. Yeah, I'll do it.
Yeah. Yeah. Okay, ma'am. Thank you. Good evening, everyone. Myself, Dr. Asha. So I'm presenting this ECE module on behalf of Group J1. Am I audible, ma'am? Hello.
Yes, you are. Yes, you are.
Yeah.
Please go ahead.
Okay. Thank you. Okay. Under the able facilitator, Dr. Rajeshri Chandar, who was very meticulous in mentoring us. So the ECE module is on cataract. It is for first MBBS students in a hospital setting. So before moving on, what I would like to put into the notice is we have to consult with alignment and integration team for the cataract before this designing this ECE module. So this alignment and integration team, when we consult, so it's clearly understood that this cataract, it comes under three departments mainly, that is in the department of anatomy, in the department of physiology, as well as in the department of ophthalmology. So considering this ECE module in the department of anatomy, the competency given is AN 41.2, that is anatomical basis of cataract. So it is a knowledge domain on KH level of Miller's pyramid, and it's a non-core competency. So the objectives would be here is at the end of ECE session, the student should be able to describe the gross anatomy and structure of the lens, and then enumerate the various types of cataract, list the risk factors of cataract, enumerate the various symptoms of cataract, and the ophthalmologic testing of for cataract. This may be describe or demonstration of the ophtho testing for cataract, and then describe the treatment modalities of the cataract, and finally communication and counseling with empathy in a patient of cataract. The teaching learning methods which will be used here is small group teaching with the aid of actual patient. If it's not available, with the aid of a simulated patient or video or role play or a paper-based case. So the clinical case scenario which could be included here is a 65-year-old retired school teacher with a history of diabetic mellitus and hypertension presented to the ophthalmology OPD with complaints of gradual onset of blurring of vision, difficulty to see in the dim light, fading or yellowing of colors, and requirement of bright light for reading and frequent changes in the eyeglass. So this clinical scenario can be either used as a paper-based case, or it could be performed as a role play if feasible. And of course, after this clinical based scenario, various ophtho tests which would be performed will be included. And the facilitator guide for this would be: what is the probable diagnosis? What are the various risk factors associated? Mention the various symptoms of the disease. What are the various ophthalmologic tests which will be performed? And what are the preventive measures, and enumerate the various treatment modalities. So the learning experience here is introduction and instruction to the students, which will be for a duration of 20 minutes, and then exposure to the clinical context for 45 minutes, discussion for 45 minutes, summary and conclusion 10 minutes, reflections 30 minutes, and assignment for a duration of 30 minutes. And the resources which would be needed here is OPD setting, actual patient or simulated patient or video, faculty from departments of anatomy, physiology, and ophthalmology, and various instruments which will be used for ophthalmologic testing and the various AV aids. The observation guide would be the students would it can be divided in a group of 3 or 6 as per the convenience. The instructions to the students given is during the consultation with a cataract patient, observe the interaction between the doctor and the patient carefully. Observation guide provided to group A is observe the history taking and communication between the doctor and patient, and then with the inspection of the eyelid, eyelashes, conjunctiva, pupil, etc. Testing for pupillary reflex and accommodation reflex and dilatation of the pupils. All these tests are included in group A itself because we have numerous tests which will be in the observation guide of group B. Then in the observation guide of group B, observe the different examination procedures undertaken by the doctors, that is visual acuity using a Snellen chart, near vision chart for the assessment of near vision, Ishihara plates for color vision, visual field assessment, slit lamp examination, and retinal examination. Majority of these tests would be taught to the students in the physiology clinical labs. So it's better to take their help also here so that they will learn it and then they can come to this ECE session. Then observation guide to group C is counseling of the cataract patient with respect to risk factors, symptoms, visual goals, treatment modalities, and complications. The patient interview encourage one of the students in the group to interview with the patient regarding how this illness has impacted his or her life. After this, coming to the reflections. So the reflections would be grouped into 3. What happened? What did you learn from this experience? So what? What are the applications of this particular learning phase? What next? What knowledge or skills do you need to develop so that you can handle this type of situation? And the feedback would be the initial feedbacks are for the students and the final feedback will be for the faculty. The feedback for students would be prior knowledge about the topic, importance of this ECE session in clinical correlation about the anatomical basis of cataract, and what is the student being asked to observe, like positioning of the patient or examination in the setting, how they make the dark room, etc. Everything the student is being asked to observe. And then what the student might learn from the observation, importance of communication and counseling with the patient of cataract, and written and the faculty feedback would be written feedback from the faculty regarding their opinions as to whether the outcomes were achieved and any suggestions to improve this particular program. And since it's a non-core competency, the assessment would be mainly focused on formative assessment, that is on the case-based learning, MCQ, short essay question, short answer question, or OSPE. If it is shared with physiology department, we can even plan for OSCE sessions too. Thank you.
Thank you, Dr. Asha, for that very clear presentation.
Okay, thank you, ma'am.
We now move on to the next presentation by Dr. Kulbir Kaur from Group J2 on the topic cavernous sinus thrombosis in a classroom setting. Dr. Kulbir, do you wish to share your own screen?
Yes, ma'am, I'll share my screen.
Please go ahead with the presentation.
Am I visible, ma'am?
Yes, you are visible.
Okay. Good evening, everyone. Myself, Dr. Kulbir, presenter from on behalf of Group J2. So we have compiled EEC module on cavernous sinus thrombosis for phase 1 MBBS students in the classroom settings. So this has been done under the able guidance of our facilitator, Dr. Rajri ma'am. So ma'am, this EC module has been mentioned in the MCI document under the competency AN 30.4, that is describe the clinical importance of dural venous sinuses. Now, in this, the objectives are that there's at the end of the ECC session, the phase 1 MBBS student should be able to enumerate the etiology of cavernous sinus thrombosis. Secondly, list the complications of cavernous sinus thrombosis and discuss the anatomical basis of various signs and symptoms of cavernous sinus thrombosis like ophthalmoplegia, exophthalmos, periorbital edema, dilated pupil, etc. Then in this learning experience, whole of this will be covered in about 3 hours time. So in this, the introduction and instruction to the students will be given in 20 minutes. Exposure to the clinical context, that will be paper-based case or video, followed by a discussion in small groups under the facilitator's guide, that will be covered in 90 minutes. Then reflections in 30 minutes. Then formative assessment in another 30 minutes. Now in this, the teaching learning methods which will be used, that will be the interactive lecture. So in this interactive lectures, students are prior asked to go through the gross anatomy of the cavernous sinus. Then online video clippings can be shown to the students. Then case-based learning in small groups. Then coming on to the resources which are needed. So in this, we will need the skull, models, charts, patients' video clippings, then paper-based case, AV aids. That is audio video aids that will be required. So in this paper-based case, the case scenario that we can take is of a 56-year-old woman who was admitted to the emergency ward with the chief complaint of fever, with rigors, low level of consciousness, unilateral bulging of the right eye, periorbital edema, dilated pupil, and ptosis. She gives a history of infected painful furuncle near the upper lip, 5 days back. So in this case, the facilitator's guide that will be provided to the students, in which what are the routes of spread of infection to the cavernous sinus, what is the dangerous area of the face, what are the anatomical basis of the different clinical signs. So this all will be discussed by the facilitator. Then coming on to next after this resources, coming on to the feedback. So feedback will be taken from the students so as to evaluate for improvement in the ECE session. So that will be how helpful has the ECE session been in improving your knowledge about the topic cavernous sinus thrombosis, which components of the session helped them to learn, did the ECE session make learning basic knowledge of topic more interesting, are you interested, are you motivated to read further on this topic so as the result of the participating in the ECE? Then suggest any changes that can be made in the ECE session so that will help in further learning of this topic. Then last of all, the assessment. So this assessment can be done in the form of structured long answer questions or case-based questions on the cavernous sinus. Then asking the students to submit the assignments on cavernous sinus thrombosis. So these assignments can be given in the form of PowerPoint presentations, etc. So this way, that's all. With this, I end my presentation. Thank you, ma'am.
Thank you, Dr. Kulbi, for that very vivid presentation. We now move on to the next presenter, Dr. Mridula from K1 group, guided by Dr. Punita Salvan ma'am, on the topic carpal tunnel syndrome in a classroom setting. Dr. Mridula, do you wish to share your own screen? Dr. Mridula, are you there? Dr. Mridula?
Hello.
Yeah.
Hello.
Do you wish to share your own screen, Dr. Mridula?
Yeah, ma'am, can you share the screen for me?
Yeah, I'll do it for you. Please give me a minute. I'll do it for you.
Thank you, ma'am. Yes, ma'am.
Yes, you may go ahead, please.
Good evening, all. On behalf of K1, I'm going to present a case in the classroom setting. I thank for the opportunity. This is a teamwork under the able guidance of Dr. Punita ma'am. So my competency is, we have taken the competency, explain the anatomical basis of carpal tunnel syndrome. This comes under AN 12.4. The objectives under this, mention at the end of the session, the MBBS student should be able to mention the attachments of the flexor retinaculum, describe the boundaries and contents of the carpal tunnel, list the causes for carpal tunnel syndrome, discuss the clinical features related to the carpal tunnel syndrome, state the complications of the carpal tunnel syndrome, should be able to draw the diagram of cross-section of the wrist at the level of flexor retinaculum. What are the treatment strategies involved in the carpal tunnel syndrome? Should be able to demonstrate the testing of the median nerve. And last, compare and contrast the effect of carpal tunnel syndrome with injury to median nerve in distal forearm. Example, post-slashing of wrist attempt like that. The teaching learning methods, what we use for classroom setting, as it is a classroom setting, we can have a video lecture. The link for that video lecture has been provided. We can have a role play, or we can have a case-based learning. Example for the case-based learning, we have given a case. A 50 years old woman presented to clinic with numbness and tingling in her hand. The symptoms are worse in her right dominant hand with activities such as holding a book or brushing her hair. The discomfort in her hands frequently wakes her at night and she has to hang her hand out of her bed for relief. What is the provisional diagnosis, and discuss the functional and anatomical functional correlation of this case. So we have planned a session of 3 hours. So usually in the morning hours, 9 to 12 for 3 hours. It is divided into various parts. The introduction and instruction to the students are given for 15 minutes. The case-based discussions with video presentation is done for 20 minutes. After the case-based discussion, we have a small group discussion with the students of 20 to 25 batch with a presentation from each group. It will be taken up for 75 minutes. Later, assessment is done, and this assessment can be considered as a part of the formative assessment, which is done for a period of 30 minutes. Later, the summary and conclusion for 10 minutes, reflection writing for 20 minutes, and feedback is 10 minutes. The feedback is taken both from the students and faculty on a pre-validated feedback questionnaire in the Google Forms. The resources needed for this is a online video tools, the audio-visual aids for that, the demonstration rooms, the different case sheets, and if available, standardized patients can be taken. The feedback is taken in the form of a reflecting writing, in which 3 parts are included: what happened, so what, and what next. In what happened, they will be summarizing what is the things, what they have observed, and what is the things. So what is the effect of that, and what next is what they are going to learn from that. The assessment, we can be included as a formative or a summative. Formative, we can keep as a multiple choice questions, short answer questions, or OSPE. And this case can be taken as a summative assessment in the form of a clinical based questions. Whenever we are conducting a final exams, we can give a case scenario and we can have a final as a 10 marks question also. Thank you. Thank you for the opportunity. Thank you, ma'am.
Thank you, Dr. Mridula, for that wonderful and clear presentation.
Thank you, ma'am. Thank you, Punita ma'am and the team.
We now move on to the last presentation of the day by Dr. Prabjot from K2 group on the topic elbow fracture or any other upper limb fracture in a hospital setting. Dr. Prabjot, do you wish to share your own screen?
Yes, ma'am. I want to share my screen.
Please go ahead with the presentation.
Yes, ma'am. Is my screen visible to everyone?
Yeah, it's visible now.
Thank you, ma'am. Good evening, everyone. I am Dr. Prabjot, presenting on behalf of Group K2, and we have prepared an ECE session on the topic elbow fracture under the guidance of our faculty, Dr. Punita Salvan, ma'am. There is not any direct competency on elbow fracture. So we have taken a relevant competency from UG curriculum volume 1, and that competency is on the, basically it is about the elbow joint, that is AM 13.3, identify and describe the type, articular surfaces, capsule, synovial membrane, ligaments, relations, movements, blood and nerve supply of elbow joint, proximal and distal radioulnar joints, wrist joint, and first carpometacarpal joint. So we have prepared the EC session plan on the clinical aspects related to this competency. And this session plan is for 150 students, and the duration of this session is 3 hours. And it is planned in a hospital setting. Details of the session plan are like this. In the first 20 minutes, the faculty will be giving a set induction to the students. The faculty will be sharing the objectives of the session, and they will tell about how the session will proceed, and then the instructions for filling of the observation guides, and a small pretest can also be taken for 5 minutes through Google Forms. Then for the next 60 minutes, the students will be going to the hospital, to the seminar room in orthopedics department, where we are expecting 4 or 5 elbow fracture patients, and the students will be observing the doctor-patient interaction, and they will fill those observation guides. Then the students will be coming back, and a case-based learning session with videos followed by a small group discussion will be there for 60 minutes. It will be followed by a post-test, reflective writing for 15 minutes, and then the feedback will be taken from the students for another 15 minutes through a structured questionnaire. So the objectives which we have framed for this ECE session regarding the clinical aspects, and we have assumed that basics which are required for this competency have already been covered. So the objectives are, at the end of the session, the students will be able to demonstrate the movements and bones forming the elbow joint in articulated bony skeleton, describe the anatomical structures related to elbow joint, enumerate the common fractures and dislocation around elbow joint, describe the three-point bony relationship and its importance in fractures around elbow joint, describe the mechanism of injury and deformity in supracondylar fractures of humerus. That is one of the most common fractures, so we have taken this. Then describe the age of appearance and fusion of ossification centers around elbow joint. This will help the students for evaluating the x-rays. And then describe the anatomical basis for neurovascular deficit in fractures around elbow joint. Eighth SLO is to evaluate the radiograph of elbow joint with regards to fractures, dislocation, and ossification centers. Then regarding the 8Com objectives which are related to the 8Com, recognize components of doctor-patient relationship with regards to attitude, ethics, and professionalism. And then they should be able to communicate empathically with patients admitted in wards. So the case which we have frame for this competency, keeping in mind the anatomical aspects of the elbow fracture. A 6-year-old child presented with pain and swelling in left elbow. The child is unable to move his elbow. General condition of the child appears to be normal. He has a history of fall few hours back while playing on outstretched hand with elbow extended. On examination, there is tenderness in elbow region, and S-shaped deformity appears to be there in arm. In X-ray taken in anterior-posterior view, fracture line is seen at the distal end of the humerus above the level of medial and lateral condyles with medial displacement of the distal fragment. Can you explain the anatomical basis for the signs and symptoms of this child? So the resource material which is required for this ECE session is Inpatients in orthopedics ward, if OPD patients are available, then they may be taken. Then radiographs of the elbow joint may be procured from the radiology department. Normal and fractured ones both are required, and then the videos for the case-based session. Then teaching learning methods which we have used are case-based learning through interactive lecture using videos and PowerPoint. Then small group discussion will be focusing more on the X-rays, and a DOAP can be done for the movements of elbow joint and skeleton. Then reflective writing can be used here as a teaching learning method, and the students will be writing on what happened, so what, and what next, and that will be leading to reinforcement of what they have learned from the session. Here the students can also reflect on their emotions about the session besides the content of the session, how they felt about all this EC session. Then assessment for the different SLOs. The first SLO, which is about which is skill based, so it can be assessed through an OSPI procedure station with checklist. Fourth, fifth, and sixth SLOs, they can be judged with OSPI station, OSPI question station, where images of the X-rays or X-rays can be put there, or other deformity images can be there. Then second, third, and seventh SLO, which are more of cognitive domain, they can be judged through short answer, long answer question, then MCQs, which may be case history type of. Then other assessment methods which can be there are through the submission of the timely submission of EC logbook, then submission of the observation guides, and then there can be assessment of reflections also, what students learn. Then feedback about the session will be taken through a structured feedback. It will be a structured feedback through pre-validated questionnaire, and it will be containing questions about the conduction of the session, then interest generated by the session, and what knowledge students have gained through it. I am sharing the observation guide. Um, the observation guide, which we have prepared after so much discussion and deliberations in the group. So first, its 3 points are on the doctor-patient relationship. Whether the doctor has taken consent from the patient, is empathetic to the patient, and then various components of doctor-patient relationship, like whether he has given treatment options and explaining the rationale of these treatment options to the patient. And then the examination part will consist of general examination and local examination. In general examination, basically the students have to observe for the radial pulse, as brachial artery may be injured in this kind of fracture, and pulse and BP measurement students usually learn in physiology, so it can be taken. Then in the history taking part, the students have to observe whether the doctor has asked about recent history of fall or history of previous fractures. Then local examination for the elbow fractures, the student will be focusing on examination for swelling, deformity, neurovascular deficit is there or not, as various nerves can be involved in the injury can be there to the nerves, to the radial, median, or ulnar nerve. And then examining whether the doctor is examining forearm for other fractures. So this is all about the EC session. I want to thank the whole of my group for active participation of all the group members, and then special inputs and various inputs were given by Swati ma'am, Mradula ma'am, and Mamta ma'am. And above all, Punita ma'am has guided us all in preparing this session. So thank you all.
Thank you, Dr. Prabjot, for the clear presentation.
Thank you,
With this,
ma'am.
we are coming to the end of the presentation session. And now we move on to the review session. The first two presentations by Dr. Bhavana and Dr. Rekha Maruti on catheterization and episiotomy, respectively, will be reviewed by Group A. Group A, do you have any review points to share here? Anyone from Group A? Group A, anyone wishes to share any review points? about catheterization and episiotomy modules? You may please raise hand. Deepthi ma'am, should I move on?
Yes, ma'am. I think both of them had complete presentations. I don't think there's anything to discuss.
Anything
in
to
fact,
discuss?
in fact, everybody has presented really in detail,
Yes,
and
ma'am.
it's
There's
really
a lot
good.
of difference now. Yes, ma'am.
Yeah, it's a complete like a lesson plan, just not
Yes,
guidelines on conducting the ECE module, but it's like a minute by minute, like the plan that has been presented. And
yes, ma'am,
there's
exactly.
nothing, I just liked Dr. Bhavna using that biomedical waste also, like
yes,
as
ma'am.
one
Yes,
of
ma'am.
the objectives.
Truly, yes, ma'am.
Yeah, that
It
was
is
a
need
good
of the
point.
hour. It has to be taught to students.
Yeah.
So shall I move on to the other review groups or?
Hi. Yes, ma'am.
Group B, do you have any review points to share about the presentations on Down syndrome and Turner syndrome by Dr. Suma and Dr. Swati, respectively? Group B, ma'am, Dr. Vijayalakshmi has raised hand.
Yeah, she's been unmuted.
Yes, Dr. Vijayalakshmi, you can speak on. Dr. Vijayalakshmi? Dr. Vijayalakshmi, you've been unmuted. You can speak on. Probably she's not there.
Yes, ma'am. Can we?
From Group B only. Dr. Anjali ma'am has raised hand.
Ma'am, I think in Turner syndrome, we can include concept of genetic counseling that was not touched upon.
Yes, ma'am. Definitely can be included.
Yeah. Okay. Thank you, ma'am.
Sure, ma'am. Thank you, ma'am. Thank you for the input. Dr. Vijayalakshmi, are you there? Do you wish to say something? Dipti ma'am, I'll just move on, ma'am.
Yes.
Group D, do you wish to review phallostetrology by Dr. Kanansha ma'am? Anyone from Group D there? Group D to review phallostetrology. Anyone has any comments about phallostetrology?
They need to raise their hand, then I'll unmute them, ma'am.
Yes.
Okay, Dr. Mridula wants to be unmuted. You can raise your hand if you want to be unmuted. Dr. Mridula, you can unmute yourself.
Ma'am, one small clarification needed, ma'am. For this Turner syndrome, in feedback, it was told MCQ after session to assess the understanding. I didn't understand this point. And what is the requirement of MCQ to assess the understanding actually?
Probably they meant pre-test or post-test like that.
This is for the feedback actually. So it can be a, I think it's not a MCQ. It may be a Likert scale feedback like that, I think.
Okay.
It was maybe it was told as MCQ, but I feel it was like maybe a Likert scale.
Likert scale questionnaire.
Yeah, questionnaire. We can't have MCQ in a feed to assess the understanding actually.
Yes, we cannot.
Yeah, that's what.
Do you want Dr. Swati to give the explanation? Dr. Swati Yadav? Swati Purnima, do you wish Dr. Swati Yadav to give the explanation for you?
Ma'am, am I audible? Good evening, Gunapriya ma'am.
Yeah, tell me, you're audible. Very much audible.
I just wanted to add a few points, ma'am. Like the point is regarding the Down syndrome. I just wanted all the presentations were very elaborate, very clear, and very nice, ma'am. And only for the Down syndrome, to just add on a cherry to the cake. Usually March 21st is celebrated as Down Syndrome Day, ma'am. So if
Yes.
students have to be motivated or have to know in detail regarding the Down syndrome, like group G1 can include one session for having like a small seminar or a get together of the students, bring in some Down syndrome students with, Down syndrome patients, if at all, low IQ students and low IQ patients to the gatherings, large gatherings, and cases can be presented in that way now. Like this March 21st, like if you are depicting a day, the student can recall it in future years also. So such days can be utilized for the Down syndrome, like the Turner syndrome, even for tetralogy of Fallot also, ma'am. I just wanted to add a very nice presentation by Dr. Kanan, ma'am. Like there is some videos in Cincinnati University videos regarding the congenital heart anomalies, ma'am. The videos are very nice, madam. You all can go through that. Like in your teaching learning methods, you can include that, ma'am. So I just wanted to say that, ma'am. Just add that point. That's all.
Definitely. Thank you very much for your valuable inputs, Dr. Swati.
Thank you.
Thank you very
ma'am.
much.
Thank you, ma'am.
Group C, do you have review points on Parkinson's disease and hemiplegia? The presentations done by Dr. Shadapti and Dr. Monica Srivatsava. Group C, do you have any review points to share here? Anyone from Group C there? Group C, no one is there?
Punita ma'am and Dr. Swati Yadav have raised their hands. I've unmuted them.
Swati Yadav, please speak on.
Yes, good evening, ma'am. Due to connectivity issue, I was not able to connect. Ma'am, I have mentioned MCQ in feedback. I think before taking a session, we can give pre-test, and after taking a session, we can give post-test for the same questions. And
that was what exactly I spoke for you to Swati Purnima.
Okay, ma'am. Actually, I was not able to hear that part.
Okay.
Thank you, ma'am.
Thank you, Dr. Swati. Group C, anyone is there to share your comments on the presentations by groups I1 and I2? If not, we move on. Group E, do you have any review points on the presentations by Dr. Asha and Dr. Kulbir on cataract and cavernous sinus thrombosis? Group E, is anyone there to share your views? Group E? No one is there? Group E? We move on to Group F then. Ma'am, Swati Purnima has raised hand. Do we need to unmute her?
I've unmuted her, ma'am.
Okay. Swati Purnima, do you wish to share something? I think
no, ma'am. No, ma'am. No, ma'am. No, ma'am. No, I didn't lower it. Sorry.
Okay. Yes, Dr. Kasturi. Please speak on. Dr. Kasturi, ma'am. You want to say something?
I've unmuted her, ma'am.
Yes, ma'am. Dr. Kasturi, you've been unmuted. You can speak on.
Yes,
then Punita ma'am can speak. Punita ma'am, you may speak, ma'am.
Yes, ma'am. I'm audible?
Yes, ma'am. You're audible, ma'am.
Okay. Ma'am, I wanted to ask about, I think in Dr. Kanan Shah's EC scenario, Fallott's tetralogy, STL was mentioned in the teaching learning methods, if I'm not wrong. So I just wanted to clarify about using STL in the EC sessions. Is it possible to incorporate STL in these sessions? Because we already have just 3 hours time, which is for STL session is it feasible or possible? I just wanted to clarify about that.
To my knowledge, I think it is not possible, ma'am, SDL, because it's a tightly packed 3-hour session. Yeah. Every half an hour, 1.5 hours has been actually split up, and the roles and functions to be done have been clearly defined as per MCI module. So I don't think we fit in SDL there anywhere. Otherwise, we'll be running out of time and maybe we'll have to exit it by another 1 hour.
Yes. So
So I
just
don't
wanted
think,
to clarify about that.
yes, ma'am. That was a good point raised, ma'am. Thank you, ma'am.
Thank
Group F, do you have any review points on carpal tunnel syndrome and elbow fractures? Anyone from
Guna,
Group F?
Gunapriya ma'am, Dr. Swati Purnima here, ma'am.
Speak on, Swati.
Ah, no, ma'am. Like after seeing all the presentations, like the learning experience, everybody has elaborately made it, ma'am. But one point I wanted to see is, according to EC document, we had a single pro forma in that learning experience, ma'am. So, for the classroom setup and for the hospital setup, if we have one preformed pro forma or a format, like that would be guiding everybody easily. Like all of us have gone, like, yeah, it depends upon the content what you're going to deal with in the ECA. But what I feel is, whatever statistics or whatever time, stipulated time have been allotted for each learning experience, it is better to have a guided single performer. I just wanted to put this and have opinions from others also.
Sure, sure.
For cataract we had these many 15 minutes for introduction. Like the introduction part and instructions part itself varied in each of the presentation, ma'am. So what I felt is, depending upon the content, can this introduction part be put from some 10 to 20 minutes, like a fixed range? So if there is a fixed range, then I think so the scenario can be well, like explaining the students would be very easy. Like for the hospital setting, wherever required, the hospital rounds and going to OPDs, and that the time period there can be increased. Like in some of the presentations, 45 minutes, 40 minutes have been mentioned. I don't think so for making going out through OPDs and the wards, it will take more time, ma'am, more than 40, 45 minutes. I just wanted to add this and just get opinions from others.
Sure, definitely. Well taken. Anyone else wish to share any other points or comments on the presentations done today? Anyone else? No? Ma'am, shall I just show my review points, ma'am, with your permission?
Yes, ma'am. Yes, ma'am. Yes.
From the presentation sent to me, I had some small queries, ma'am. Not in all the presentations, only in few. Down syndrome and Turner's. Initially, I think what I received, the patient being utilized, the session was not included. So I have given the comment, can a patient be shown to the students? Down syndrome, they may not be admitted at the time of ECE, but the pediatric department will always have the contact details of the patient and the parents. So they can always contact, if you well coordinate with them much ahead in time. The pediatric department will have time enough to contact the parents and bring the student, bring the patient on the day of ECE session, so the students can have a look at the patient. Students might have seen such patients in their life, in their neighborhood, the families or neighborhood, but they may not know that this is a Down syndrome. But when they see it in the learning session or learning environment, they will know that this is a patient who's a case of Down syndrome. So like that, we can, instead of showing just only a paper case or a video, we can always show a live patient to them. Likewise for Turner syndrome also, but I think it was discussed in the presentation. The initial module that I received, the soft copy module did not include about the patient being shown, but today in the presentation, they had modified it. So that was okay. For phallostetrology also, a patient can be shown. And coming to hemiplegia module, Dr. Monica presented this. Perform the clinical examination of cranial nerves, elicit motor involvement, and scale the muscle strength. Do we do this in anatomy? These SLOs, are they anatomy SLOs? Because they look like, to me, like physiology SLOs. Ma'am, Deepti ma'am, what do you have to say in this, ma'am?
Yeah. clinical examination of cranial nerves and range of movement
We don't
of
do no, ma'am.
muscles is done in physiology.
Physiology, yes, ma'am. We don't.
Yeah, and deep and superficial reflexes, sensory laws, all these
Everything
are
is
done in physiology.
in physiology, yes, ma'am.
Yeah, like someone had suggested in the chat section that anatomy and physiology can have combined ECE sessions as well. Some of the institutions do that. I think that would be a complete, like now we are dividing them into silos, anatomy ECE, physiology ECE, and so on. Like when we are ready to share the topics of central nervous system between physiology and anatomy, we can share ECEs as well. It
as
would
well.
be a complete one.
Yes, ma'am. Then these SLOs will be really meaningful, valuable at that time.
Yes.
Yes, ma'am. Then the module on anatomical basis of cataract, I like that observation guide, ma'am. 3 different groups observing 3 different criteria. One was observing the patient interaction, communication with the patient. One was observing the examination, the visual acuity examination in the patient, and the other one was observing the patient counseling. My question to Dr. Asha would be, clarification, not a question, clarification. Dr. Asha, are you there? Dr. Asha, are you there? Because they are divided into 3 groups. So group A, B, C, how will group A learn the observations made by group B and C? Likewise, how will group B and C learn the observations made by the other 2 groups? That was my query.
Yeah, that's a good question. Hello, ma'am. Can you hear me?
Yes. Yeah, you're audible. Yes.
Yeah, yes, ma'am. That's what, as I said earlier, all this Ishihara chart, everything, visual acuity test, majority of the things are done in physiology itself. So what we need to do is we need to consult with the physiology department people along with the alignment integration team. And then we need to plan our lesson module in such a way that it coincides with that alignment. After the physiology people have done those clinical testing, everything, then we are taking these students for ECE session. Then I think it would be easy. Because majority of the ECE module included in this cataract, major component or the chunk is given to the physiology department itself. So we need to plan our lesson by all the 3 departments, that is anatomy, physiology, as well as ophthalmology. That's what I felt, ma'am.
Okay, fine.
Okay.
So the reflection strategy was very good. I like that what happens, so what, and what next. That really kindles the interest in the minds of the students for a very rich learning experience, really. So that was really nice.
Thank you.
Yes.
Thank you, ma'am. Thank you. Thank you so
for
much.
all the modules. We should follow it for all modules.
Actually, this is the one which is clearly stated in this MCI module also. That is reflection strategy. Yeah.
Yes, exactly.
Okay.
Ma'am, Deepti ma'am. Thank you, Dr. Asha.
Thank you, ma'am.
Yes, ma'am.
Deepti ma'am. These modules, can we preserve, compile and preserve all these modules and utilize in our own departments also, ma'am, in our own institutions?
We will take consent from all the participants who have actually developed and the resource persons. Here, I just want to add, ma'am, in the earlier ECE session, which I had moderated, there was no elaborate, laying down of these ECE modules. So I request all those faculty of the previous session to make it a little more elaborate using, I think that was the consensus we came to at the end of that ECE session, that observation guide, facilitator guide, and a little more elaborate teaching learning methods should be made by all the participants. So once again, I request all the resource persons and the participants of the last session to make it a little more elaborate after all the discussions that we have had. And then, as you said, ma'am, Gunapriya ma'am, we can have the list of all the ECE modules. They are so well prepared by all the faculty. So,
yes, ma'am. We have so many of them now, ma'am. So many are there. Whichever is suitable for our institution, we can use it.
Exactly. And of course, we have to take consent from all the people who have developed the
definitely,
ECE
ma'am, because
modules.
it's their brainchild anyway.
Yes, ma'am.
Their own work. Yes, ma'am. We need to get their consent. So from this, we are able to see very well that we are walking quickly up the Miller's Pyramid ladder from a novice in ECE a year ago and to a performer now, to a 100% performer now. So when compared to the previous session and this session, we can make out the difference to what extent we have all evolved in the structuring of the ECE modules. So this is what is really called an enriched learning experience. So though faculty, we are all learners. We are still learners throughout our teaching phase or teaching career. Ma'am, can I give my closing points?
Yes, ma'am. If anyone else wants to share, just
Dr. Asha is raised hand.
Yeah.
Dr. Asha?
Hello, ma'am. Yeah, hello, ma'am. Actually, would it be better to formulate EC sessions for core competencies? Hello?
Most of these come from core competencies, no? Only a few are
Some of them, a few of them were from non-core competencies. So better to include the core competency ones for the EC session. That's what I felt.
Yeah. In our institution, we have used all 10 modules from core competency only.
Yeah, okay.
That's what will be tested upon repeatedly, frequently when he goes to phase 3 also. So we've used only all the 10 are core competencies.
Okay,
Asha, ma'am,
okay,
can you please point out which are non-core, ma'am, so that we can change the topics?
Actually, my presentation on cataract was non-core, ma'am.
Okay, it was non-core. Okay.
Yeah,
we can
it
change
included.
them.
Yeah, it included most of the physiology topics like acuity testing, etc.
I know, yeah, visual testing,
Yeah,
acuity testing.
not much from the anatomy department.
Anatomy part, exactly.
Yeah.
I think you can share it with your physiology department.
Yes.
Sure.
From all the modules that we have actually presented, actually, as I mentioned in the last session, I should have gone through what are the topics. In fact, I didn't go through what are the core topics and then pick up. I just picked up topics which were commonly present in, like an Indian medical graduate, the kind of cases they see as private practitioners, those were the cases that I picked up. Some of them turned out to be core competencies. As you have rightly pointed out, Dr. Asha, some are not. So if participants themselves tell me these are not the core competencies, I think we can change the competencies and make the, like a few of
one
them
uniform list we can make, can be made, which would be feasible for all.
Yeah. Can we have, from the participants, it would be very nice if all of you together made, a list of competencies or list of ECE topics that all of us could use.
Okay, ma'am. Yeah, sure.
You can discuss in your 2 groups and you can decide and come up with a list, including all core competencies. I mean, most of the important clinical core competencies.
Okay. Thank you, ma'am.
Ma'am, should I say my
yes, ma'am. Yes, ma'am.
So from the last 2 sessions on ECE modules presentation, it's very evident that all of us have really learned a lot in the planning, structuring and implementation of ECE modules in our own institutions. So the first batch is already done, almost over, waiting for exam. And the second batch, I think all of us will be very good performers in ECE sessions or in implementing ECE sessions in our own institutions. From the reflections that we obtained in our institution from our students who have just finished their exams, phase 1 exams, for many, early clinical exposure sessions were the highlight of their first academic year, often reinforcing their original desire to study medicine and allowing them to experience the real world of medicine. This is exactly the words given by a few students in their reflection notes when they submitted to us. They felt that they were on cloud 9. They're able to see patients. They're able to learn about the disease. They're able to learn about the diagnostic modalities available, treatment modalities available, what is a hospital setup, the administration, the hierarchy in the hospital. They're able to learn all that in the very first year, which their seniors did not have the opportunity for. So that way they were in awe for early clinical exposure sessions, and they were always waiting for any ECE session that would come up in the next few days for them. Whenever we intimate or announce to them, they were so happy with the ECE sessions. Though they had to go here and there to the ward and OP and all, they really liked it because it was giving them a very enriching learning experience. So this is what I wish to share when I close now. So thank you, Dr. Sanjay Bedi, sir, for this wonderful opportunity to me. And thank you all resource faculties for your motivation and support.